Good morning, ladies and gentlemen. My name is Frank Bowles, and I'm the host of Senior Care Solutions. My goal is to bring the most knowledgeable professionals for senior care in the Dallas-Fort Worth area. And today I have two guests that will answer a lot of your questions and some of the most difficult questions and concerns that you have in the process. Welcome, Joyce Logan and Patty Williams. Please tell us a little bit about yourself and your company.
Okay. I'm Joyce Logan, and I am originally from Ohio, but I've spent most of my life in Texas, then Ohio. And I first started my career in social work and did something else totally different before Ruby Care became a vision of mine. And then this is Patty Williams.
Hi. I live in Tarrant County, and I've been in the healthcare industry for over 20 years. And about 4 years ago, Joyce asked me to become her partner in Ruby Care. So it just was a nice transition from what I'd already been doing with hospitals and large medical practices to come in and look at senior care.
Well, that's interesting. We've got Joyce and Patty, but the name of your company is Ruby Care.
Yes.
Tell us a little bit about the name.
Well, Ruby Care became my vision after helping Ruby, my mother-in-law, find a senior living community. She lived in East Texas, and after the death of her husband, a couple years after that, she said she wanted to be near family because she was smarter than, or not, I shouldn't say smarter, but she was easier than most people that we work with, because she's the one who made that decision to move. And
that is different.
Yeah, and give up driving. So she made our life a lot easier. So when I was helping her, I first went online to get some assistance, and I didn't like the help I was getting, so I thought there had to be a better, more personalized way to help families navigate through this senior living community maze that's out there. So that's when I thought Ruby Care Senior Living Advisors would be more of a personalized touch and approach to helping families, guiding them through all the different communities, because there's like over 900 out there that includes nursing homes in the Dallas-Fort Worth area.
Well, I know that making the decision, your mom made it easy. There are so many that it's not an easy situation. And tell us, why should total strangers come to you with help in making that decision?
Well, I think part of it is just like when you're looking for a home, you go to a realtor because that person knows the industry, they know the neighborhoods, they know what's available, they know the amenities, all of that. Similar to us, we know the communities, we're in and out of them every day. We know what they offer as far as the amenities go. We know the healthcare need that they can satisfy, and we know the budget. So we're really narrowing down the search so that they don't have to go and look at all 900. They can really cull it to a list that's more manageable. And plus, we walk alongside them through the process. So, our first meeting is with them, just talking about their loved one, or we talk to the loved one directly, and we see where they live and we see what they're used to, and then we walk them through what the process is going to look like and the questions that they should ask. We go with them on the tours. We set up their tours and we help them ask questions. We take all the notes for them. We give them a spreadsheet that compares everything to them. So it's really a concierge-like service, and it's very one-on-one and personal. And then we follow up with them afterward, too.
Yeah, because sometimes we'll get a call and people will say, I need assisted living. And then once you start talking and dig, because we do a intake or a face sheet where we find out their needs and health needs, and then we really realize that it's more independent living that they may need. So we hone in, like Patty said, narrow it down to a few.
Well, there's a step actually before that, and the decision is, how do they know when it is time to make that move and to come to someone like you to find that location?
The fact that they're even thinking about it is when it's time. Because what you don't want to do is you don't want something to happen to make it be a crisis. You want it to be the time when they can look around, they can really get a feel for the places, they can go and, have a meal at the places and get to know some of the residents. So if it's something that they're planning for the future, they can really get an idea now versus, if they have a fall, they're just getting out of rehab, their insurance is about to end and they have to find a place right away. It just brings the stress level up. It brings the 911 level up for them. And so, a lot of times the loved one is the person that goes with us, or, they have a lot of input. But once they're in the hospital or in rehab and they're really, struggling to find a place, then it takes them out of the loop a lot of times. So we say the time is now. If you're even thinking about it, doesn't mean that you're going to be placed next week. It just means that you have an idea of what is going to work or what's not going to work for them.
Awesome.
Well, 80% of the people, I think, want to stay home, or maybe even higher than that. Most people want to stay home. So they try to work that avenue. I think it's mostly the adult kids that realize that's who we primarily work with, because they are the ones who realize that their parents need that higher level of care. So
there, like you mentioned, there's over 900 communities in the Dallas-Fort Worth area, and they provide different type of care and different levels of care. You specialize in not just finding a location, but matching that individual with the level of care that they need. Tell us a little bit about that project.
Kind of Joyce alluded to the fact that some people will say, my mom needs a nursing home. And we'll go meet with the family, and really what they could be very happy and very well taken care of in a residential care home, or maybe even an assisted living community that's smaller. Or the family might say they need assisted living, but really they could be in an independent living community and getting some services there, like maybe showers 3 times a week or just help getting the meals, which is what Ruby does. And so it's interesting when we meet with a family. Of course, we're talking to them first about the health need, but secondarily it's budget. And so we're trying to help them maximize those dollars to make the dollars last longer. And we even help our folks negotiate rates. So we want to make sure that they're in a place that's going to be good for everybody, and it might be a lower level of care than they were expecting, but with some augmented services that are going to save them some money, but they'll still get the same amount of care.
Well, me as kind of a novice, I haven't been through that process, but some of my family members have. And going through the process and determining the decision on what type of facility, because I think the more active you can keep them, the more the brain is working, and the younger you stay longer. Is that the philosophy there?
Absolutely. Especially using muscles and using your brain, and there are so many things with regard to socialization that we stress to our clients, because socialization is a huge part of it. It helps with dementia, it helps curtail the effects of dementia, and it enhances their health long term. So we want them to be social. We want them to have as many opportunities for that as possible. And so if you've got someone, we'll work with a family, and maybe the mom is in a wheelchair, but she can walk a little bit on a walker, and the dining room is right here, so she can she can use those legs, she can use those arms to get to the dining room, they're going to encourage that. And so that's another thing we do, is really try to even help them find the best room in the community so that it can maximize their faculties. So
Well, they say socialization is key. More people die from depression than cigarettes, smoking cigarettes. What is that percentage? I don't know, but socialization is very key. So we help people determine whether they need independent living, assisted living, memory care, or residential care home. And a lot of people don't even know the difference.
Yeah, that's what I was going to ask. Give us a little information on the difference in the different care levels.
Yeah. Independent living is where you're definitely independent, and they offer meals, and all your utilities are included in the base rent. So it's, and they offer a lot of socialization. A lot of times people say it's a cruise ship on land. So then when you can still live in independent living and have care brought in, home care or personal assistance, but then when it gets a little more expensive, then you may consider assisted living. And that's where you need help with activities of daily living, bathing, dressing.
And with independent living, typically you have a full kitchen, and the community sometimes will offer meals, so maybe 2 meals a day. So you can either use your kitchen or use the meals that are provided there. So some of them don't have kitchens, and so they'll have like galley kitchens, and they'll do 3 meals a day at that community. Right. But a lot of those communities now do offer some third-party care so that you can stay in that community longer.
Right.
And they tend to help in giving outside functions as well, don't they?
Yeah, well, I always say they have a chauffeur. So, or they have a bus, they have transportation, yeah. So they offer a lot of social events inside the community, but then they'll also have planned things outside of the community. Like they'll take you to the museum, the arboretum, all kinds of, out to eat, to restaurants and stuff, or shopping, doctor's appointments. So they have that personalized assistance where you don't really need a car when you're in independent living, but some people still have cars. People still are independent.
Some experience regarding patient or individual falls. And with that, it is a fact, the more active you are, it helps build the muscles. And with that, the activity helps with the balance. Mm-hmm. So the more active you can be, the more healthy you're going to be, I believe.
Mm-hmm. Absolutely.
Yeah. Just like us. I need to be more active.
Yeah.
Yeah.
Give us some, a little more information, like you take from the start of the process, independent living, all the way through hospice. And determining the steps of those has got to be difficult, especially to the families. Now, when it comes to the families, there is an incredible amount of guilt. You hear people say, I'd never put my loved one in an assisted living. But it gets to the point where that's the very best thing you can do for them. Give us a little information on not only that, but how you help the families.
I think we help them by showing them different communities and what they can offer, because they want their parents safe. Safety is the number one, I would think, number one point that they want to make sure that their parents are taken care of. But I think that they really need to see the communities. They can see that they offer the different levels of care, and that the staff is trained on helping the family, and that they have visiting physicians, they have nurses that really can take care of their family a lot better, possibly, than they can at home. And it can be sometimes a lot more affordable than having 24 7 care brought into the home. So I think showing them that, and then a lot of times I recommend that they get in, if they're feeling guilty, to find a support group.
Yeah.
So
The
my
other thing
sister,
too is it really does take years off of your life as a caregiver. So when we deal with a lot of people, the sandwich generation of folks that have family members at home or maybe in college, and then they're taking care of their older loved one, parent or grandparent, and so it is also all that stress is reducing years on the actual caregiver.
There are statistics that actually state that a lot of caregivers actually succumb before
Yes.
the individual.
We've
I've
seen that several times.
right.
Yes.
My sister was taking care of my mom, who has vascular dementia, at home, and it was wearing on her physically and mentally, and she was feeling guilty because she never wanted to put mom in a community. So finally, she made that decision, and it took both of them a while to adjust. My mom at least 60 days. So, and my sister now, she's doing so much better. She's exercising, she's healthy and having fun. And mom comes to visit now, and she's like there an hour and says,
wow.
I'm ready to go home. I'm ready to go back home. So, it's nice to know that both are happy now and taken care of.
There's so many aspects of senior health care. And one thing that we've all heard, and that is the attitude of the person that is being treated. If the support people, their families, will visit, will make phone calls, let them know that they are still loved and they are in their families' minds. Do you think that mental attitude and that kind of support helps the individuals?
It absolutely does. It's interesting because a lot of times we help folks where families live in another state, and so they're not able to visit or they're not able to call as much, or maybe their loved one can't take phone calls because they have a cognitive impairment. But the community really does adopt the folks. And Joyce and I always say there are 900 communities in the Dallas-Fort Worth area, but we don't take people to all 900 because there are some that don't have that type of support.
Yeah.
And they don't provide that love and care and respect for the individuals that live there. And so we are very careful about where we take people and where we place people, and we stay in constant contact with the families to make sure that we're aware of what's going on.
And there are so many communities out there and facilities. How can you get the time to really interview, and because we've all heard the nightmares. Your profession is not just to put somebody in a facility, but make sure that is the right facility for them.
Well, that's why it's important to use a company like Ruby Care, because we go with our families. We are in them every day, so we're seeing what's really happening.
Exactly.
We're talking to families in the parking lot. When we drive up and somebody's coming out, we're saying, what's going on? How is your loved one doing here? What do you like about this place? What would you change about this place? Oh, there's a new executive director. We're in there meeting with that executive director. We hear from families all the time about that they've used people where all they got was a list of a phone number and the name of the place, and then they go and it is just not the place where they should be. So we don't do that to our families. We're with them all the way.
There's constant change in the communities, so
One-
you have to be.
One of my family members went through the process, and she put her loved one in 3 locations before she found the location that he thrived in. Mm-hmm. And he literally thrived in comparison. Mm-hmm. There are stories out there where you come in and hear, my loved one hadn't eaten all day.
Yeah.
And
we pay attention to those accounts. I mean, it's important, right? Because especially you can't be there 24/7. And I mean, we do have families that'll put a camera in their loved one's room, but you can't be there all day. You have a job or you have kids at home, and so you're expecting the level of care to be what you signed up for. And so we're making sure that
These are our moms and our dads. These are the ones that kissed our boo-boos when we were this big and made the hurt
Yeah.
go away and
That's right.
drove us to soccer and to football and all of our functions. They're the people that made us who we are.
Yes.
And it may be your moms, your dad, or grandparents.
Absolutely.
Well, and I always say too to the families, even though you're putting your parents are moving to a senior community, you're still the caregiver. You're still there supporting them and making sure their care is taken care of. So don't feel guilty about, that you needed that extra support. But yeah, like Patty said, you could put a camera in a room if you don't trust the community. But seniors, I don't know if you've been around many of them, they're pretty outspoken. They'll tell you what's going on. And so like Patty said, when we're touring, and you'll be walking past one, a senior, they'll tell you about the community immediately. They love to share their stories.
They do,
And if they're happy or not happy, they
Yeah.
can get away with saying things that, you're like, oh, okay.
That is great. It has been a pleasure having you with us.
Thank you.
Would you tell our viewers how to get in touch with you?
Well, they can reach us. We have a phone number, 469-224-0122, or they can go to our website, rubycaresenior.com.
Viewers, let me make a recommendation. The decision and putting a loved one in senior care and taking them out of a home that they may have lived in most of their lives, a lot of them. You may have even grown up in that home. And it is so life-changing to make the decision to take your mom, your dad, or your grandparents out of that home and put them in assisted living. It is not an easy decision, and making the right one is of utmost importance. And most of us, when we do that, we are novice at making that decision. We need professionals such as Ruby Care to help us with that. Please do not hesitate to reach out to these ladies. They're here to help you.
May I say one more thing?
Absolutely.
I forgot to say that our service is complimentary. It's free. We get paid by the communities. Like Patty said, we alluded to earlier, we're like realtors, but social workers, we're a combination of things. So our service is free too.
That answers a big question. Ladies and gentlemen, thank you for joining us, and we look forward to seeing you the next podcast.